cardiologist and vice president of medical affairs for Hello Heart. Thank you, doctor, so much for joining us this morning. First of all, let's talk about the seriousness of this particular diagnosis for Joe Biden. What is he facing?
When we look at Joe Biden at 82 years of age, we have this stage 4 prostate cancer. And what does that mean? That means prostate cancer with mets, meaning it has spread to other areas. Specifically, it would need to be distant lymph nodes or bones. In this case, it is bones. And so when we look at mets, it really means that this is not curable, but it is treatable and it is manageable. And certainly with the explosion, really, of all types of therapies that have become available in the last 10 or 15 years, specifically with prostate cancer, his prognosis is not necessarily terminal, especially for a man who's 82 years of age, because we can expect a life expectancy of 5 to 7 years and maybe even out to 10 years with therapy. However, at 82 years of age, we might expect that he could die with this prostate cancer as opposed to dying from it, just supposing that his life expectancy may not be 10 years or more.
And so how long do we suspect that he may have been suffering from prostate cancer? The fact that it metastasized into the bones, are we talking months, years that he may have had that cancer? And how is it that it was undetected?
It appears that he has an aggressive form of cancer, especially as we know that Gleason score is 9. That is really one of the highest grades of a Gleason score. The top grade is 10, but 9 is really one of the highest grades of a Gleason score, and it gives you an indication of how aggressive this tumor is. And so there are some subtypes of prostate cancers that really can proliferate or move very quickly in between, shall we say, those annual PSA checks, so that prostate-specific antigen, those blood tests where we are marking and trying to monitor the levels of your prostate-specific antigen in your blood. These are rare, but there are subtypes where you can have an aggressive momentum in between your annual physical exams.
And so what does it mean that the cancer seems to be hormone sensitive, and how does that affect the treatment? What kind of treatment will he be undergoing?
You know, Holly, it used to be, because the prostate cancer is really driven by the male hormone testosterone. So it used to be the treatment that we had for patients with prostate cancer was to remove the testes, remove the organs that produce the testosterone. Now we can do that chemically, blocking androgens, which is a type of testosterone. So blocking these androgens, not only blocking them, but then we can also block the areas where they are produced, so block that synthesis as well. So 2 different steps, and that has taken the place of actually the removal of the testes. Generally, these types of cancers are actually very responsive once you remove the hormone that is actually driving the growth of these cancers.
And how difficult will it be for the treatment? I mean, the fact that he is 82 and the fact that we've seen him, he does not appear to be in the best of health. So what will this do to the body, and how can he handle this at that age?
Yeah, I am presuming that they will move forward with androgen blocking agents. And, there are other agents that are coming of age, really, in prostate cancer. This is really a big and exciting area, including immunotherapy agents. Now, his bone mets, depending on the pain and how large and how many there are, he may also receive some type of palliative or radiation to the bones to try to control those mets and make certain that he is comfortable and can remain mobile as well. Certainly, you bring up a good point. He is 82 years of age, but the fact of the matter is that prostate cancer, like many cancers, increase as we get older, and we've become better and better and better at treating older patients with cancer as people live longer.
In terms of President Biden, he had been having difficulties walking lately, and his team said that was because he was suffering from arthritis. But could this have been the cancer and just not known it since it had metastasized to the bones?
There are some mixing of those symptoms. Bone pain, could it be arthritis? Could it be other things? And that's part of the challenge we have in all of medicine. Sometimes symptoms are cloaked as other symptoms. So certainly it could be. It also could be that he has both things. He has arthritis, and he also has bone mets, which also may have made the diagnosis a bit more challenging.
And what are some of the symptoms of perhaps the beginning stages of prostate cancer? For those in our audience who might think, well, could I get this? What should people be looking for? And about what age should we be really concerned?
Prostate cancer, just to give you some statistics, there are about 300,000, 315,000 cases per year here in the United States, and about 15% of cancers are prostate cancers, the number 2 cancer for men. And so when we look at it, it's really not that uncommon. Symptoms oftentimes can be urinary symptoms. So your urinary stream is becoming less forceful or narrowed. You also can have urinary tract infections if you are having some challenges with urinary tract infections. And there's also pain. And occasionally, if you develop any type of infection, you also might have fever. The physical exam, you can have a direct physical exam, and by inserting a finger into the rectum, actually palpate the prostate, which is possibly one of the better ways to actually do a physical exam and palpate that prostate to see if it has enlarged at all. It's generally an apricot size organ, and you can palpate it digitally just to see if it has enlarged. And apparently that is actually how it was detected here as well, just direct physical examination.
And, how hard is it to diagnose on a normal basis? I mean, you say that's a fairly easy way to detect, but I mean, is it difficult to find it if somebody may or may not have symptoms yet? And once it is found, the earlier it's found, is it easier to cure, hopefully, or keep, manage it?
Certainly the earlier you find it, the more likely you are to achieve a cure. Stage 4, which is the stage at which we see the former president now with prostate cancer, is no longer curable. So the goal is to treat it and to manage it, because this stage is not curable. What do we want to do? We want to check simple blood test, PSA, prostate-specific antigen, when men go in for their annual physical examination. And if there is any rise or any concern with that PSA level, then certainly your doctors can move you forward for other tests in that diagnostic workup. Now, the PSA does tend to increase as men get older, but what we watch is the doubling of that PSA, or there's only a certain increment that we will allow it to increase within a year or within 2 years, within a certain time frame, before we begin to be alarmed. And generally, any PSA over 4, over 5, generally will move you forward to further workup regardless of your symptoms.
Dr. Jane Morgan, thank you so much for your insight this morning, as we all wish the former president well.
We certainly do. Thank you, Holly.